everyone. I will be discussing about laryngeal mask airway. It is a supraglottic airway device which is used in elective as well as in the emergency situation. So it forms a seal around the laryngeal inlet. Here you can see this is the epiglottis, this is the laryngeal inlet, and this is the esophagus. And here the cuff of the LMA which is placed around this laryngeal inlet. In clinical practice, many types of LMAs are in use, but the common ones are classic and proceed. The common parts are airway tube, the cuff, and the pilot balloon with inflation line. There are few key functional differences between the classic and the Procel LMA. The first is the airway tube is reinforced in the Procel LMA along with the bite block to prevent kinking. The other difference is there is a separate port for Riles tube placement here. The size of the LMA depends upon the weight of the patient. Usually in adults, size 3, 4 and 5 are required. In adult females, the size 3 and 4 usually fits. And in adult male, the size 4 and 5 is required. The volume of air that is required to inflate the cuff can be calculated by this simple formula, that is size minus 1 into 10. So in this way, in size 3, 4 and 5 LMAs, the volume of air required to inflate the cuff will be 20, 30 and 40 ml respectively. In pediatric patients, size 1 and 1.5 is usually fit in less than 10 kgs children's, and in 10 to 30 kgs children, size 2 and 2.5 is required. Now the indication. In the ICU, it is an alternative to mask ventilation or endotracheal intubation for airway management, in especially in emergency situations where the mask ventilation or the endotracheal placement is difficult. Coming to the preparation part, we have to choose the appropriate size LMA according to the weight of the patient, and we have to keep a 10 or 20 ml syringe ready. Keep before placement, check for leaks by inflating the cuff and lubricate the posterior surface with water soluble lubricant jelly. A suctioning apparatus should be kept ready to clear the pharynx at any point of time. Coming to the LMA placement technique. Step 1 is we have to hold the LMA like a pen with the help of index finger and thumb of the dominant hand. Open the mouth with the non-dominant hand. Next, insert the LMA into the oropharynx with the aperture facing the tongue. Slide the LMA along the hard palate as it is advanced towards the hypopharynx. Advance with gentle pressure until resistance is met. After the placement, inflate the mask with the recommended volume of air. The LMA rises up slightly out of the hypopharynx as it is inflated and takes its position. After that, confirm the placement by observing chest rise and auscultation, and secure the LMA in place with the help of adhesive tape. Thank you.